meaningful use, Parkview, I feel we're a little ahead of the game. We've currently received all of our incentive money for Medicare and Medicaid for both versions of Stage 1 and Year 2 Stage 1 money. We are in the process now. We want to fully be ready for Stage 2 come October 1st, 2013. On that date is when we want to start our 3 months of attestation so that we can attest for Stage 2 in January of 2014. Currently, right now, we're working with our vendor as we speak, and in our test environment right now, we are running the Stage 2 ready software for both our ambulatory and the eligible hospital. Some of the big things that we're working on right now also with our vendor is to have a patient portal that's fully integrated amongst the hospital and the ambulatory side, which not only is it a requirement for Stage 2, but we think it's going to be a great thing to offer for our patients. So that's a really big project that we have going on right now. Another big piece for Stage 2 that I think is going to be the biggest challenge for us in all hospitals is how they have quality measures. Well, as part of Stage 2, that's going to be very key for hospitals, because what's going to happen is that's how hospitals are going to be submitting their quality measures for everything else as well. So now when people, you have people in the clinical areas that go through charts and they, put all the data together and they submit your quality. Well, what's going to happen in Stage 2 is all that quality measures. So we run these reports. Right now we're running them, but they're only saying you have to have a numerator and denominator. You just have to prove that you can do it. We'll come down to Stage 2. That's going to be how your quality is submitted for your hospital. So it's very key that standardization amongst the physicians, that everybody is doing everything the same way. That's the key right there too, is the same way and working as a group. So if something isn't working right, we got to make sure that we make changes that, it needs to roll down to all the clinicians, because standardization is going to be the key. We're always wanting to be on the bleeding edge. So the biggest challenge for us is working with the vendors and trying to get up to that next level. So a lot of these things that we're implementing, and one thing that's important to mention too, everything that we've done here at Parkview, we've done with our own staff. We have no outside consultants. We have an IT team of 6. Wow. But what I like to say is our IT team is 6, but usually these projects are hospital projects as well. So we have great super users out there. We have great support. We have a CMIO at our hospital, which really makes a key difference. He's very involved. Not only is he a practicing physician, but he also dedicates a lot of time for IT as well. And what this allows us to do is have that liaison between the clinicians and IT. And we work on things together all the time. So we're both in the rooms a lot at the same time, working on the same issues. It's key to education of why we're doing what we do. We've done a lot of, I think a challenge was explaining to people why we're doing this. And a big challenge is always every time you do something, making it part of standard work. We're big, and if things are standard work, then it rolls into the next stages. So I think we've done a great job on Stage 1 of actually, when we got to Stage 1, we're really doing this stuff. So everyone's doing CPOE. CPOE now to me isn't even, that's a no-brainer. That's no problem here at Parkview. It's when you start getting to, the discharge process, e-prescribing within the inpatient areas. Those are the type of things that we have the technology in place. It's just a matter of, having it be it's just how we function at the hospital. And like I told Dr. Losi and I talk all the time, who is our CMIO, is we really how are we going to handle areas where a doctor goes on vacation and you have a locum come in, or you handle those things. We really need to make it our culture that there is no paper, that this is how things are done here and you have to do it. If we could have anything we want, I don't know, maybe a little bit more money. So capital. We're in a unique situation because this whole meaningful use of a lot of these standards, it was kind of our vision back in 2004. So we made an investment on going to a single vendor solution for both hospital and ambulatory way back in 2004, which we showed, yes, we spent millions of dollars, but we showed over a 5-year period just what we saved in maintenance would pay for itself, and it has. And right about the time it paid for itself, then meaningful use was announced. So Parkview so far, year to date, has collected $3 million in incentive money on a $320,000 investment.
Wow.
So that's a little bit unique. We're a little bit unique in the area where we're actually making money off of IT in the current, state. I actually came into healthcare IT. I came from L.L. Bean and IT at L.L. Bean, and then I just happened to see a job posting for the hospital, and I thought, oh, that would be great, area to get into in IT. You can't outsource it. I think I see a big future in there, but when I came to Parkview and interviewed, they didn't even have email. And they only had 20 regular PCs at the time and using Twinx, and I started looking around thinking, oh my gosh, this hospital's so far behind. There's so much I can do to help them out, as far as intranets at the time. There's so many things that I thought would help them, not realizing I just assumed that all hospitals were fully electronic at that time. I had no clue that, that was the norm back then.
What year was it?
That was about 1998, 1999.
A lot has changed.
A lot has changed. So we started, showing these savings, things that you could do even that were out there at that time, not realizing that not many hospitals were doing that at the time. So we didn't realize what we were doing until we were the 26th hospital to make HIMSS Analytics Stage 6 in the country.
That's pretty impressive.
And the smallest at that time. So when we realized that we're one of 26 out of 5,000 something hospitals, we knew that we were doing something quite unique over here, and we were doing it with our own staff, our own people. We're at the time now where they're actually very anxious for it. They're excited about it. One thing that's going to be unique about our patient portal is it's actually built by our vendor for both the ambulatory and the hospital, so it's one portal for all areas. And some of the things that we think we're really going to benefit on is we have a team that we've built around this because it's very involved in patient access, billing, health information management, IT. This portal is a total team effort. And again, with Dr. Lucy, our CMI, involved at all, our goal is to go into the portal as starting smaller and working our way up so that we build the foundations. So we're all meeting to say we know that we want to go live right away with online bill pay. Things that we're working out that if we're going to do it now, are we going to have shared, can you email your provider, can you not email your provider? Do we want to allow patients to their own scheduling? Do we not? What do we want to have available to the patients so that they can download? How long do we want to wait before lab results are ready? And we got to make sure that we do a lot of communication with our providers, because if we're going to say that lab results are ready 3 days after they're done, well, we want to make sure that our doctors are looking at them 2 days before they're done, so that we don't have all these patients calling our providers knowing their results before the doctors do. So I think the big challenge on that and the excitement is just education and making sure we get the word out of how it's going to function. And I think that's the key. And I think from there it'll just snowball in.